Um, there you go. Welcome, everyone. Great to see you today. It is almost the end of August. I can hardly believe it. And we're allowing folks to kind of roll in to the August all call. And we'll be with you in just a minute. Or we can talk about the parents who have ushered their little ones back to school for the year. How's that? Anybody have any insights into the return to school and how that's been going? You would have to come off mute to share. I haven't noticed, yeah, huge. There's been a shift in traffic, but not like I remember from some years, but any parental thoughts?
As much as I love my kids, Renee, I'm glad to have them back in school.
Hey, the structure is good, right? For the whole family.
Yes, it does mean increased traffic when I'm going to work, but in this case, the traffic is worth it.
That's great. Oh, goodness.
Hey, Renee, this is Marcel. I don't have any little ones, but I was on a meeting the other day and they said they were glad for their kids to go back to school because they wanted their bills to go down, meaning food bill, electricity bill, all the bills they run up in the summertime.
Well, I imagine that's true. It only gets worse when they're older, though. My two boys that are in their 20s, I'm like, good God, you boys you're eating me out of the house. I'm glad you
yeah.
can join us, Marcel. Thanks for being here. I was wondering
Yeah,
if you were
sure.
going to we're gonna, it's 4:02. I still see people coming in. We'll get started in just a moment.
Hey, Jaquan.
Hey, Marcel.
How you doing today?
I'm doing great. Thank you,
Good,
Renee,
good.
for thinking of me and for this opportunity.
If for the attendees, if you can just put your name, your organization, maybe some contact information, phone or email in the chat in case a lot of times people find folks on the call that they didn't realize existed, and they want to reach out afterwards and have a conversation or explore partnership or collaboration opportunities. So feel free to do that so I know who's on the call today. And I think are gonna go ahead maybe and gear up. We're at 24, almost 25 folks. I think that we could have a big showing today, or it could be that folks are just now getting back into the swing of things. But regardless, I want to sort of officially welcome you to the Gwinnett Coalition's August All Call, which is essentially a gathering of all the nonprofits in the community and partners who are doing great work on behalf of children and families in our community in need. And today, we have a special guest. Typically, the format, if you're new to joining us, is we have one or two organizations or topics that we highlight. And then we save room at the end for sharing of activities that are going on in the community and any kind of questions or topics that people want to lift up that we might need to be aware of or think about or help work together on. But glad to have you here today. And I'm going to go ahead and introduce our highlight organization for the day. And it's Georgia Family Connection Partnership. And I don't know if all of you know, but we, as a reminder, the Gwinnett Coalition serves as the Family Connection Collaborative for Gwinnett County. There is an entity in almost all the 159 counties in Georgia. And the mission or the focus of these various organizations are really just all aligned in helping to support and provide resources and all sorts of things to help families be healthy and for the children to thrive. So today, I'm really grateful to have, well, first of all, Marcel Johnson, who is the region manager, which she's actually has two hats today. And Marcel, I did see you were on camera a second ago. Would you like to just take a minute to introduce yourself? And I know I didn't ask you in advance, and that's fine if you can't do it as well. And she might have stepped away for a second. We'll come back to Marcel if she's around at the end. But Marcel is my region manager. And she provides a lot of support in helping us be sure that we're aligned with Family Connection priorities. One of the resources that Family Connection offers is access to the Annie E. Casey Foundation data set, which is called Kids Count. And so academic year and much of our work is often focused around family and children, and so the school year is part of that cycle. We encourage you and hope that you use data to make decisions about your programming and where you're focusing your support and that kind of thing. So thanks to Jaquan Jordan. He's a data manager for Georgia Family Connection Partnership, and he's here today to kind of show us what that data set is with Annie E. Casey Foundation and how we might use it. There's opportunities to disaggregate, which we know is so important as we really peel back the layers of what's happening in Gwinnett. So without further ado, I'm going to turn it over to Jaquan, and with a big thank you of joining us today and helping us know what resources are available for us in the data realm.
Thank you so much, Renee.
Yeah.
And thank you all for taking this opportunity or taking the time this afternoon. I know you all do incredibly important work in the community and local community. I appreciate that and thank you for that. And as someone who graduated from Berkmar High School, I know how, Gwinnett pride, right?
Yeah,
So,
I didn't even think to ask you. I saw the Georgia Bulldog, but I didn't think to ask you about the
and
Gwinnett
also,
connection.
and also a proud Georgia Bulldog. Yes, ma'am. So yeah, I would like to first get started by letting you all know what to expect from this. We're just going to be doing a review of the Kids Count data, looking um, specifically at some Gwinnett Kids Count data, right? And doing a review of the disaggregated data tool that we offer at the gafcp.org website. But in addition to that, also go over some additional sources from our state data partners that you can access local data and disaggregate it in any way that you like. In addition to that, I know that talking about data, particularly disaggregated data in this new policy environment can be difficult. So would like to share some tips with talking about that disaggregated data to hopefully make it a little bit easier. All right. So as Renee kind of introduced, Kids Count is the national project by the Annie Casey Foundation. It was started in 1990. That original ranking, we were ranked 48th out of 50, out of all the 50 states. And based off of that, the governor at the time, Zell Miller, decided to pilot a project for delivering technical assistance to each of the counties to help them with child well-being programs and initiatives. And I can happily say that 30 years later, the GAFCP and the Georgia Family Connection Network, as Renee said, is representing all 159 counties across the state and have been since 2004. So the Kids Count and National Kids Count has already been influential in Georgia, but just kind of a review of what that looks like nationwide. As I said, each year, Annie Casey is going to rank all 50 states. This year, the release was June 9th. And those rankings are going to be on the 4 domains that you see here: economic well-being, education, health, and family and community. And within those 4 domains are 4 indicators as well. So for 16 total. As you can see in 2025, our ranking was 39th. It actually worsened from the year prior where it was 37th. 37th was the highest ranking that we reached, and we reached that in 2003 and plateaued in 2004 and ended up seeing this worsening or regression in the rankings during this release. So in these next slides, I'm going to basically show how that kind of happened, right? So we'll begin with kind of the area in which we regressed the most, which was the economic well-being domain. We went from 32nd to 37th in this domain. You'll see that one indicator where we got particularly worse was children living in households with a high housing cost burden. And you'll see in the other indicator that we either got better or we stayed the same. And so, well, how does our ranking, worsen if we got better in 3 and only got worse in 1? As I said, that these rankings are done nationwide, right? So what that essentially means is that the states around us or states that improved that rose that ranking or rose up that ranking did better than we did, improved better than we did. And so you'll kind of see that trend throughout the rest of our domains. Education, we went from 31st to 32nd, again, got worse. And you'll see that 2 particular areas in which, I hyper focus, which is literacy and just school age and school grade math. You'll see that we also got worse. Georgia, particularly, we got 7%, 7 percentage points worse in our 8th grade proficiency for math. And again, this falls in lines with the trend of the nation. Nationwide, we notice in the kids count data that there have been worsening 4th grade proficiency in reading and 8th grade proficiency in math. So let's go to somewhere where we did show some improvement in our kids count rankings in 2025. Our health domain, we improved. We went from 43rd to 40th. And our low birth weight actually says that we worsened from 2019, but we actually improved from the last 2 years that we had data, which was 2001 and 2002. The low birth weight rate in 2001 and 2002 was 10.6. And that was the highest that we've had in Georgia in over 10 years. So we did make some progress as far as going from 2022 to 2023. But as you can see, the trend, we've worsened. And the other places where we got worse is our child and teen deaths. Our child and teen death rate has continued to worsen, and you'll see more context on this in the following slide. But that is also one of those indicators that nationwide we're seeing a negative trend, and we're seeing an increased amount of child and teen deaths, unfortunately. Finally, the one domain in which there was no change in these kids count rankings was the family and community domain. And you'll see that we got better in teen births, as well as children living in high poverty areas. All right. So what are some trends that we've been able to identify from this kids count data? So as I mentioned in the previous slide, the rate at which 4th graders are scoring below proficiency, it worsened to 70% in 2024, right? Representing a 2% increase from 2019. So that's that 5-year span. That children living in high poverty areas, as I mentioned, so it improved from the previous year. However, it has increased by 66,000 children from 2019 to 2024, right? So that was an approximately 11% increase in that 5-year span of time. So again, just a sign of how important it is to use trend data when you're discussing any of these. Because trend data is going to give you more historical context, right? And so as I had mentioned before, that child and teen death rate, we've seen a 21% increase from 2019, which, as I said, mirrors that national rate of, or mirrors that national increase as well. However, ours is slightly more. And so what does that 21% increase in that 5-year span mean? Well, it means that in 2023, there were 174 more deaths than their child and teen deaths, right, than there were in 2019. So that 21% increase is significant. Okay, so that is what the national NEKC kids count data tells us. But what about the Georgia kids count data? So in addition to us being the grantee for the national kids count, and our responsibility for as a grantee is to ensure that we're uploading data to the national NEKC Foundation website. But in addition to that, we maintain our own set of 52 indicators spread across those 5 result areas as you see there. And those 5 result areas happen to also mirror our vision. So you will notice in the chat, I put 2 of those tools that you see here on this slide. And in addition to that, there are 5 interactive tools. So those tools are filled with those 52 indicators that we aggregate from our state partners. Some of our state partners include the Georgia Department of Public Health, the Georgia Department of Education, GOSA, so the Governor's Office of Student Affairs, and Georgia Decal, and et cetera, et cetera. You can see that this list are all state partners who all publish their own public data, and they're ensure that they perform accurate and timely collection around the state. So in order for their data to be included in our kids count indicators, we ensure that they increase I'm sorry, we ensure that they are basically included or covering the 5 criteria that we have for our data. And so with that, we're able to put together a picture of what Gwinnett kids count data look like. And I just pulled some what I thought was interesting data just to get us started, right? So teen deaths ages 15 to 19, which is a Georgia Kids Count indicator, increased from 35.81 per 1,000 teens to 67.71 per 1,000 teens from 2019 to 2023. So what does that look like? That means that looks like an additional 24 teen deaths, right, in 2023 than there were in 2019. So again, just something that's important is always try to look at the context of what this data is actually telling us, right? And so as I said, that increase is the important part. An additional indicator that I thought was interesting for us to track, and particularly for Gwinnett County, because you are all a larger county, disaggregated data is going to be your friend. And so this is the beginning of our example of why disaggregating data is going to be particularly important for Gwinnett County. As you all hopefully have gotten a chance to look at the Birth to 21 snapshot and the Georgia profiles a little bit, you'll see that Gwinnett County data, the rate is often going to compare very favorably to the state rate. Because you are such a large county, you're going to be able, or unfortunately, you're going to hide some populations within your large numbers. So just an example of that, the infant mortality rate decreased from 7.4 infant deaths per 1,000 in 2019 to 6.0 infant deaths per 1,000 in 2024. Georgia's rate is 6.5 per 1,000. So just for context, I pulled this fresh data from Oasis. So these numbers are not going to be on our tools because we're currently in the middle of updating all of our tools. So you will have 2023 data, but these, I just wanted to pull fresh data for you all to have an example of. But so as we see when we break down and disaggregate that, what that infant mortality rate is actually composed of, right? So yes, it's great that the county's rate is 6.0 and the Georgia rate is 6.5. But as we look at those numbers disaggregated, the Black and African American rate is 8.7 per 1,000. right? That's higher, not only higher than the county's rate, but it's also higher than the state's rate, right? We see that the white population is 5.6, which is lower than the county and lower than the state. And then we see that the Hispanic is 7.2, right? Higher than both as well. So just the importance of looking at these numbers or the data in a way that gives you detail and a clear picture. Another example, as I talked about and discussed, literacy being a major topic across the nation, but in Georgia as well. When we look at the third grade students achieving proficient learner on these milestones, right, we see that in Gwinnett County, the rate went from 43.18%, right, proficiency to 45.01%. All right, and the Georgia rate was 38.7%. So again, doing better than the state rate. However, when we disaggregate that again, we see that those numbers are not. We see that there are disparities in those numbers. We see that the Hispanic population, unfortunately, is doing below not just Gwinnett, but also the state itself. So as I said, the importance of disaggregating data, particularly for a larger county, cannot be underscored. So where did I get this Gwinnett data? Well, I'm glad that you asked me that. You're going to be able to access this data and by going to the gafcp.org site. You'll hover over this data banner. And by doing that, you'll be able to get a wealth of resources. But I plan on focusing on the data tools today. As I said, you will get access to the birth to 21 snapshots, as well as the Georgia profiles by clicking on Georgia profiles, the birth to 21 snapshots. But in addition to that, there are other tools that are helpful. The indicator improvement calculator is particularly helpful when setting SMART goals for program or any type of grant implementation. The comparable county tools we emphasize for our county collaboratives, but they're particularly helpful for everyone, but they are helpful. It's a helpful map with collaboration. The tool is going to allow you to see other counties that are similar to you based off of the demographic breakdown, as well as the median household income. And then we have our Kids Count Indicator Explorer, which is going to be our exhaustive tool that will allow you to look at all of the Kids Count indicators with historical data. So it's going to allow you to look at trend data.
So Jaquan, it looks like Tim had a number of questions, right?
Oh.
And so one of the things he asked about, who the other partners were regarding the data. So I put the link to the indicator so he could see that each indicator has specific, partners and data sources associated with it. And I see that Renee put in the link for this link that you have here for the data tools.
Yeah.
And I think he had a couple of more questions, didn't he, Renee?
He did. Jaquan was on a roll. First of all, let me ask you this. Jaquan, at the end of your presentation, will you please are you able to put your presentation in the chat so folks can download that? Is that a possibility?
Yes. I can do
Okay,
that.
so we will make the presentation available, so don't worry about that. We just talked about the reporting. There was a question, sort of earlier about, we're not so far up on the list, right, in terms of doing things well. The question was, do we know who the states are that are doing well in various areas? Have we benchmarked what they're doing so that we know what works and then potentially being able to overlay that here? And I can't find the exact question, but it was essentially,
Yeah, that's a fantastic question. So yes, we do know the states that are ranked above us. We also know where they're ranked above us and how that progress, right, has kind of occurred because we have access to everyone's historical data. So the benefit of being a Kids Count grantee is that we not only get access to our data, but we have access to all of the Kids Count Network's data. And so in addition to kind of being able to look at where we may need, some attention or some things to work on, we're able to identify where other states have improved, and because of the network, we're able to reach out to them and ask them, what are some programs that are going on, right? So similar to that, kind of as I was talking about the comparable counties, right? The collaboration of within the network allows us to identify areas in which what are some ways and we may implement some type of targeted programs to help us improve as well.
So we may lean on you in the future. We could sort of take each of these priority areas and highlight the top 3 in the nation that are doing things well and see how we might glean some lessons, right, from that possibly.
Oh, of course, of course. And the Annie, and I'll put that, so I guess in addition to the presentation, I'll also put the National Kids Count Data Book, and the Annie Casey website, so that way everyone can see all the resources that they have available, because they also do a good job of highlighting specific states and within that, like, programs that are doing well and that may also be receiving a grant, right, from the Casey Foundation. But they do a podcast and allow those kind of directors of those programs to give kind of steps on and feedback on how their programs were implemented and things that they could would recommend.
So add that to your list to post at the end. And before I let you get back to your plan presentation, there's a question about data broken down geographically.
Yes. And so that was one of the tools that you see here, the interactive map. And that is one of the tools I'm actually going to show a picture of, but I wasn't planning on going super in-depth into that one, so I can just address it now. It does break data down by census tract in addition to county, right? And as I said before, we're in the process now of, for the first time ever, doing our 2 updates a year for our Kids Count data tool. So within that second update of this year, we're also going to be adding that map will be available by state Senate and state House districts. So you'll be able to get not only county data, but you'll also be able to get data, right, like by those 3 sub-county measures. And I'm also going to show Tim a way for you to utilize the census .gov website to you'll be able to basically go even further than that, go into zip code and city.
But Jaquan does also, kind of come back and do an interactive kind of training where, folks can get a chance to kind of use the various tools here and learn to use them.
And so I know that we had, when Renee reached out, I know we talked about talking about specifically Gwinnett County data. But what I found particularly, I think particularly useful for Gwinnett will be these disaggregated tools because of the size of the county, right? I think that some of the other tools, as far as, right, the profiles and things, I do think because of the size of the county, you miss the details of where the disparities lie and where the resources are needed to actually be allocated.
That's a real thing. And one more thought, there was a question about child well-being index, and I can tell you, having looked at both sets of data, you will see consistencies in Gwinnett. We've got Family Connection or the Annie E. Casey Foundation data. We've got available the United Way Child Wellbeing Index. We've got Live Healthy Gwinnett. We've got the Public Health Department's data. You will see very strong similarities across all these data sets about what's happening in our community. And so to the extent
that's because the source of the data is not changing, right?
That's
it's
exactly
just how it's being presented, right?
Exactly. Yeah. All right, let's get back on. I'm going to save the question about macro environment and data risk for the end for you. All right.
Sounds good. All right. So today we're going to be focused on this disaggregated or the data disaggregated by race and ethnicity. And I will also, again, like I said, show you some of the interactive map and just some other tools that'll help you with your, disaggregated data. So our data disaggregated by race and ethnicity tool is another one of those tools that has been completely reimagined and rebuilt. So I'm super proud of my team. I just wanted to kind of brag on them a little bit for that. So when you first open the tool, you'll notice that you'll be able to select your county in this first drop down. You'll also be able to select through 36 indicators, I believe. 23 kids count indicators. And so why is it not the full list of the 52 indicators? Well, because the indicators that make up this data disaggregated by race and ethnicity are specifically our indicators from GOSA, OASIS, and our census indicators. So these are our indicators where we receive our data that's broken down, right, disaggregated by race and ethnicity. Unfortunately, as I said before, all of our data, we do not collect it. We aggregate it from our state partners. So we receive the data that we receive, and so we're not able to provide broken down disaggregated data for every county for all 52 indicators. So that drop down has the indicators for you to be able to select through. You'll notice that we have our race and ethnicity for each of the lines painted next to our chart to make sure or ensure that there's clarity. So with that, you're able to select. So if you click on one, it will remove it from the graph. If you double click it, it will highlight it. And so that we designed it that way to ensure that you're able to not just look at the data, but also use it for visualizations, for social media, for charts, for grants, for anything that you may deem a visualization helpful. So you're also able to hover on each of the points, and it's going to give you the detailed number and specifically it's going to be a chart tool. Or a tooltip, as they say. So it's going to be able to give you the exact specific numbers. And once you're in the actual tool, once you hover over the chart, there is a download this chart option. So this paragraph on the side here is context. So the kids count team, in addition with our evaluation results and accountability team, as well as a hired outside HTI consulting firm, we ensured that we didn't want to just give this data, particularly disaggregated data by race and ethnicity, outside of we know we're not giving this data in a vacuum. So we didn't want to just give you this data without additional context. And so we ensured that we reviewed peer-reviewed articles and had discussions and wanted to make sure that we gave historical context with these numbers that we're presenting. And most of the messages will also be linked to the peer-reviewed article that we discussed and pulled this message from. Okay. And so that context button at the top, and I'm pointing into it as if you can all see it from my screen. So that context button at the top essentially gives you that paragraph explanation of that context on the side, just in a much more eloquent way than I just provided. So if you'd like to get that clearly, you can click on that button. And at the bottom there is the slider. As I said, the tool, we wanted to ensure the tool was not just going to give you the data, but also be functional and help you with your work. So the slider at the bottom allows you to focus this visualization in to specific years that you want to target or that you want to highlight. And it also helps you see the visualization more clearly, right? Allows you to, as I said, share those insights in a lot quicker and an easily more digestible way. Okay, so as I kind of explained on this tool, you will be able to choose all 159 counties. There will be those 23 kids count indicators that I discussed that come from the Census, GOSA, and Department of Public Health data. And so this current data is 2022 demographic data. And you may be saying, well, Jaquan, how am I supposed to use 2022 demographic data? Well, again, the data is extremely important always from year to year, but the trend data can always give you insights and be particularly helpful when discussing data disaggregated by race and ethnicity because it's additional context. The history using the trends is just additional evidence to support your statements. So what is using those tools to discuss, right? Kids count data and disaggregate it look like. So this visualization is actually pulled from our Kids Count Indicator Explorer, where you're able to compare Gwinnett County in Georgia, right? And trend data for low birth weight babies. And as you can see, Gwinnett has historically been lower than the state, right, in its rate. We talked about the power of hiding, kind of hiding some of your data and your results in larger numbers. And so there's an illustration of that here. Now, what is using that disaggregated tool look like? Well, immediately, right, we recall that Georgia has the 10.2 and Gwinnett has 9.49. We can look at that bar of that 10.2, right? And we see that most of the races are near that line. However, we see a large outlier, right, in that light green line, which is the Black or African American race and ethnicity. So we see that there very clearly, right, that there's a disparity by just looking at the disaggregated data. With that, as I said, you're able to highlight the actual numbers. And we can see that in 2022, the percent for low birth weight babies was 13.03 in the African American community, right? That's almost double what it was in the white community. Right. And so we can see that even though Gwinnett's 9.49 is lower than Georgia's 10.2 low birth weight rate, we can see that there's still work to be done, right? And where those resources need to be allocated in order to do that work. And so Tim, you asked about our interactive, or we asked about data disaggregated by geography. So this is pulled from our interactive map. Within it, you can see that there are a whole lot of census tracts in Gwinnett, because again, that large county. Within that, you can see that there are pockets, right? And so this is children living in poverty. And we can see that even though Gwinnett County, and if you look on and this is, I kind of did that on purpose. If you look at your Georgia profile that I put in there, you'll see that Gwinnett is actually doing better than the state's rate in children living in poverty. However, we see through this disaggregated tool, right, disaggregated by geography, that there are pockets where that does not exist, right? Red indicates greater than 10% worse than the state's rate. And so we can see that there are a number of pockets that are red, as well as pockets in there that are yellow. And so thank you, Tim, for highlighting that data is not only disaggregated by race and ethnicity, right? In addition to that, it can also be disaggregated by geography. It can be disaggregated by age, sex. There are a number of things that are a number of ways for you to disaggregate that data. And so our suite of tools offer you two ways to do that, disaggregated by geography as well as race and ethnicity. And as I pointed out, um, you will be able to also get your data by state house and state senate very shortly. And I will ensure that Renee knows as soon as that is available, so that way she can update you all.
Yeah, we'll certainly communicate that in an exchange that we send out to the entire community. And having it by the legislative districts will be really helpful. I'm grateful. I can tell your team has been doing a lot of work since you arrived a year ago. Johan, congratulations.
Yeah, it's all my team. I just lucked up. I lucked up into the right spot. So, but you know, I will say in just a brief moment that I appreciate the work that I've been able to, you know, in a roundabout way support, but also witness all the work that, you know, the coordinators and our local partners are able to do on a local level. It is inspiring to see, and so I appreciate that. Appreciate the opportunity while I'm here, and so I feel like the least that I can do is help you all access the data, right? And you know, hopefully present it in a way that you all find it interesting. So, in addition to our suite of tools that I kind of highlighted, there is also Oasis, the Oasis website, the GOSA site, Get Georgia Reading, as well as census data. And you'll see that I put the Oasis data and GOSA data has fresh 2024 data, which we do currently have, and we're working on implementing in our tools. But if you, in the meantime, are really need to access it, you can go to the Oasis and GOSA website. And Get Georgia Reading has a great set of tools as well for you to disaggregate data, and I'm going to show you those as well. But I also would like to say that I am a resource, and you can reach out to me for data requests as well, because like Buddy the Elf, I love data, and data is my favorite. So Oasis is the Department of Public Health website, and you can disaggregate data by race and ethnicity, again, sex, age. You're also able to do it by socioeconomic status. And it is the kind of one-stop shop for public health data. You can get mortality data. So that's infant mortality, as well as just general mortality data, as well as maternal mortality data, and emergency room visits. That data is going to cover cardiovascular disease, diabetes, other ICD-10 codes. Your birth data and maternal health data are also available at Oasis. And I put the link there. As well as another source, a great source of disaggregated data is GOSA. GOSA has a number of dashboards, particularly useful ones where you can break down data in a number of ways, like the K through 12 student discipline dashboard and the high school graduate outcomes dashboard. So the other data that we get from GOSA, they do have available, but they are in Excel spreadsheets. As I mentioned, I'm a resource. If you don't feel like going through the Excel spreadsheets, I will be happy to. You can go onto the GOSA website provided there and see for yourself, or as I said, reach out to me as well. So the Get Georgia Reading website, Get Georgia Reading website has a fantastic Tableau dashboard that allows you, and is the student achievement dashboard. That'll allow you to look at all of the milestones, the third grade and fifth grade milestones, both ELA and math. And you're going to be able to look at them by school in addition to by county by school district. And within that, you're going to be able to disaggregate in the many ways that I listed there. And I also wanted to put their readiness radar for early learning programs at the top as well, because those are important for pre-K programs. And you can see that link there. And lastly, the place where you're going to be able to get the most disaggregated, as I kind of alluded to it earlier, you're going to be able to disaggregate geography all the way down to zip code in some large cities. I would imagine Gwinnett has a number of them, but disaggregate this data by, these data by a number of different ways, right? That includes geography, race and ethnicity, sex, all of those things. The census is our wealth of knowledge and information. It's where we get 11 of our kids count indicators. And the main source that we kind of pull our data from is the American Community Survey. And they give you 1 year and 5 year estimates. Ours are all 5 years because, again, that history and trend or context is more important to us. But 1 years are also particularly helpful if you're looking at smaller locations because they're able to estimate. But within that, you'll be able to get business, education, employment, health, housing, and income and poverty data. And I put that website link there. The census.org site or census.gov site is daunting. And it can be daunting or overwhelming if you're not familiar with it. So as I said, I just like to remind you all, I am a resource.
Jaquan, we're approaching time. Is there, I mean, I don't have much more, how many more slides you have, or
Yeah, no,
a
it was
couple
just
questions.
just these last two, basically benefits of using disaggregated data, and I'm sure they've kind of pointed them out here, but just discovering disparities, right? And it improves your decision making, and tips for using the data, disaggregated, define your objective, identify your audience, understand data gaps, and use accurate data. And so if you have any questions or you have any data requests, please reach out to me. My email is here. And I'm going to put this presentation in the chat. And,
Oh.
yep. So
Oh, and a survey. There are a few questions, and then but folks, take a picture. Surveys are great because then it tells us what more we can do for you, how better we can support you. So, question about the GOSA data. Does that also include the results from what used to be the Georgia Student Health Survey, around student climate or school climate?
Great question. So no, the Georgia School Climate survey is actually administered by the Georgia Department of Education. And so we will have those indicators, that data will now become kids count indicators. However, our board is approving that in October. Because it is a new source of data, we have to have that approved by our board to ensure that we're basically ensuring fidelity with our criteria.
All right. Our housing people feel like there's a lack of data to support their efforts. Any recommendations for other sources, maybe outside of the ones that you presented today?
Yes. So outside of the sources today, I definitely say the Census Bureau, not the Bureau of Labor, also has the population survey, the community population survey. So the CPS, which is available on the Census Bureau Department of Labor, I believe, website. So it'll be the Department of Labor's website, and they have the Bureau of Labor. There you go.
Okay. This is a
Let me you know what? Let me clarify that because I want to make sure that I have that right, and then I'll email it to you.
Okay, yeah, or you might have a minute to put it in the chat as we're rounding up the other things for the
Because I do know
program.
it's the CPS, but I'm not really sure. I believe it's I'm not really sure what that government.
It might be the Bureau of Labor Statistics.
There you go. Bureau of Labor.
Okay.
That's what it is.
So they have some housing data. Okay.
And they have the CPS, which is the Community Population Survey, and they have additional indicators within that have some housing data. The census.gov is going to be kind of one of the most exhaustive ones that I've known, because the American Community Survey, or the ACS, has a number of other measures of housing, right? However, they are not kids count indicators. So
And
this
and
would be a great place to
and I
start.
guess Renee, your county probably, I guess, uses the point in time count for the homeless data.
Mark, I would invite Mark to chime in if he wants, but we have done that on an annual basis. I feel like there was an interruption during COVID, of course.
Yeah,
Um,
and I think everybody realizes that it's
It's
an undercount, of course,
Yes.
right,
but
Yeah.
right.
yeah. Mark, did you want to add something to that?
Yeah, I just gotta get my sound on here.
Mark, you can ask the big question that I was
Okay.
saving for the last.
Let me, okay, well, going back to the your first question, I do agree there is a real discrepancy between the point in time counts and all the other data sources that we also consider reliable, such as school boards and things like that. So it's useful to see trends, but it's usually at times an order of magnitude off is our experience. But I guess my other question for you is what risks do you see going forward for all your data sources, given all the cutbacks and the reorganization at the federal level? We have a lot of great data.
Right.
How much of it will be reliable or available in the future in your mind?
Yeah. So, great question. Where we particularly have to be honest, we have an environment in which the truth in general is kind of under attack, but data particularly, right? So as I kind of point out, gratefully for us, a lot of our sources are state provided. They come from our state partners. Our Oasis data, right? We know. We're kind of leaning on the fact that the Oasis data, this Department of Education, right? These sources are state run, and so are kind of shielded from that federal environment, or at least we're hoping, right? Locally, we have not seen that kind of trickle down yet, but we're on guard with that as well, right? And we kind of trying to stay ahead of that and keep an eye on it by convening our state partners and having honest conversations with them and asking them what kind of problems they may foresee, right?
Were not a lot of the state data sources ultimately funded by federal funds?
Correct. And
Okay.
so as I mentioned, we talk to our state partners, and we're making sure that these programs are basically not in danger. And we're trying to kind of stay ahead of that by having those, something that I didn't mention for all of our indicators. We have a kids count indicator review periodically to not only ensure that all of our indicators are meeting our criteria, but to also ensure and kind of forecast what potential issues we may see, right, in our data collection or aggregation going forward. But one of those sources, particularly that we're concerned about, is the census, because we do know that comes from that federal level, and we've already seen in the Population Reference Bureau, which is one of those organizations that works very closely with the census, a reduction in their staff, right? We've already identified, as a kids count grantee within our network, we've seen in other states, right, data becoming an attack, or them having to pay in order to request the data, right? So we're being mindful of this kind of changing landscape, and just to be honest, like we are trying to stay ahead of it as possible. But we're like everyone else, adjusting when we have to, right, in the current time.
Thank you for that. And Jaquan, lots of kudos in the chat for you. And please post your PowerPoint in there as we sort of round up today's. I would just say, please, you'll have the PowerPoint so you can do the survey later, but it's always just good to do it, right now while it's fresh. And there's a question in there, number 4, which says, what other topics are you interested in? So if there's enough gravitational pull or consensus around certain, we will offer more of these and get folks engaged. So please do that. And again, thank you, Jaquan and Marcel, Region 3 Manager, for joining us today. Couple other announcements. We had a great panel last week regarding funding for the nonprofit sector in Gwinnett. And if you missed it, I'm sorry, but don't worry, we've got a part 2 of that coming up this week. But we had corporate and foundation and small business and grant professional panel that just sort of gave us some insights as to how we might be pivoting and diversifying our revenue streams and all the things that we know all of us are going through right now, given all the changes and priorities and funding structures. But coming up, there are 2 things I want to call your attention to. One is advocacy and action. That's going to be on Friday, September 12th at 9 a.m. This is essentially a public policy briefing in partnership with the National Council of Nonprofits. So Jessica Mendieta, policy associate at NCN, comes to us, to our community, and she provides an update virtually. This is virtually. And you can ask questions, about what's happening real time at the federal level, but NCN and other national organizations are really advocating on behalf of nonprofits and trying to help us manage through this very difficult time. So join us. We do that once a month. There is no charge for that right now. And the details are in the chat. You must register for that. 2, Funding Forward Part 2, which is actually insights from nonprofit leaders who are doing the work every day in our community, is happening on Tuesday, September 23rd. You must also register for this. But this is going to be focused. We have 4 CEOs who've been leading nonprofits for quite a while and are successful at what they do and somewhat experts. The panelists include Laura Balance from Hudgens Center for Arts and Learning, Larry Campbell for Corners Outreach, Maureen Cornova from Home of Hope, and Santiago Marquez from Latin American Association. So we're going to be really hearing them talk about how they are weathering the storm and what are some of the revenue producing activities that they are engaging in, whether that's, kind of social impact, earned revenue, events, just really turning things up on its end, just innovation and sustaining growth. So please register for that if you're interested. The moderator for that is our very own DePriest Wadi, the CEO of Community Foundation for Northeast Georgia. So it's promising to be a really great panel. It will be hosted at the Lawrenceville City Council or City of Lawrenceville HQ, right downtown Lawrenceville. Another announcement is for you and your clients that you're serving in the community, or just for you to know for the communities that you live in. Vision to Learn is a nonprofit that does free eye exams for children. So Gwinnett County government has contracted with Vision to Learn to come and provide exams to Gwinnett County youth. I think through Gwinnett County Public Schools, it is. And so anyway, it's not through it, but just check into that. Free eye exams. There's no way a child can learn if they can't see their paper or I used to say chalkboard, but that's really dating. In this case, I guess the whiteboard or the PowerPoint screen, who knows? So that's really great. And the information about how to get an appointment is in your chat. With the last few minutes that we have, what announcements do people have or concerns that would you like to lift up or anything like that? While you're thinking, I would like I see DePriest on the call. He had a great event last week. Good to give celebration, huge success. Hopefully more funding coming to our community to support the causes that really matter. Congratulations, DePriest.
Thank you so much, Renee. Thank you everybody who came and supported and donated and prayed and all that good stuff. It was a great night, and Renee, it was really terrific to highlight you and give you some flowers during the event.
That was sweet, and thank you very much. If anyone wants to see the video, I can send it to you. Just let me know. It's wonderful. It's probably on DePriest's website right now. There's Diabetes You Can Win walk coming up, so that's in the chat for anyone who wants to attend. Anything else in our last moments together? I think that's it. All right. Well, it's 1 minute. If you don't have anything to say, we can just call it a day, and appreciate everyone coming and being part of this. And we will see you on the last Monday of September. And we'll have another exciting topic to discuss. So be sure to do the survey, pull down the, hopefully the PowerPoint, is it in the chat yet? Kids count. Thank you, Jaquan. Perfect. Grab that before you, we'll keep this live for a few minutes so you can pull down all the resources that you might need. Thank you. See you next
Thank
month.
you.
Thanks,
Bye-bye.
Marcel. Really appreciate you.
Bye. See you soon, Renee.
All righty. Mark, you still pulling down resources?
Yeah, I'll just log off in a second. Thank
No
you.
worries. There's no worries. I'm just sometimes, Rachel, are you still online? Sometimes people walk away and then I never know, like, are they really there or did they just forget? Yep, she just signed off.
Okay, I got what I need. Thank you.
Hey, you're very, very welcome. Thanks for joining us.
Thank you.
Jesse, I can close this out if you need to tap out.